You've got all that amniotic fluid in you. What makes your water break? Today I'm going to share what we know about what makes your water break and what you can be watching for to see if your water's broken at home. Side note, guys, this is a super important topic because if your water's broken and you don't go get help, it can be a source of infection. So we really want to make sure that you understand water breaking. And yes, it's more confusing than you think it will be. So make sure that you're learning from an expert. Might I add that I see a lot of people talking on this as though they have a lot of authority, but haven't probably seen a lot of people whose water has broken over a wide variety of population. So make sure that you're learning from someone with lots of experience like me. Hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am here to prepare you for your pregnancy and your hospital birth. If you are planning on a hospital birth, go ahead and give me a follow because I would love to hang out with you for the rest of your pregnancy. And be sure to like great pregnancy content like this so you're seeing high quality pregnancy content in your feed. Okay, first off, what is water breaking? So your amniotic sac is inside your uterus, which is inside your pelvis, guys, which may feel like it's crocheted about now. So here we are. The amniotic sac is inside of here, and then the baby is inside the amniotic sac. Now later in pregnancy, your amniotic fluid is made almost entirely of baby pee. Does that gross you out? Tell me in the comments. But as we know, baby pee keeps getting made. And so it's always being refilled and the baby actually drinks. And that's part of what the baby's first stools are going to be, is them drinking the amniotic fluid. So inside this uterus, you've got an amniotic sac. It's made of proteins and all the good things in our body. And for some people, it is pretty darn firm. And for some people, it is not very firm. I've seen doctors have a really hard time breaking some people's water, and some people's water breaks very easily. We aren't exactly sure why, although I do believe that it has to do with your nutrition in pregnancy. So make sure that you're eating the good things during pregnancy, especially protein. At some point during pregnancy, your water will break. Now, most people's water breaks in the hospital. About 85% of people have their water broken during labor. Your provider will take an amniotic hook, put it into the birth canal, up into your cervix, and just snag it a little bit and it will break. However, a lot of people's amniotic fluid breaks while they're at home or at the grocery store or whatever. That's about 15% of people it breaks before getting to the hospital. When it breaks, you may feel a trickle of fluid or you might feel a big gush. It is more confusing than you think. I have a whole video on it. I will link it here. So the question I get sometimes is, can you make your water break? Please, please, please. This is not a DIY job at home. You could really cause an infection. When we give the doctor the little crochet hook, it is sterile and it is meant to do the job. It will not hurt the baby's head. It is meant to do this job. Whatever you're thinking about using at home is not meant to do this job. So please do not try to break your water at home. Side note, residents even have a really hard time getting this task down. It is a skill that providers have to learn. Now, if you're earlier on in pregnancy, you're thinking, could my water break at any time? Well, yes. I mean, just like anything could happen at any time. For you, you just want to be watching for the symptoms. If you're feeling your underwear wet, that's something you want to bring to your provider's attention, especially early in pregnancy. Later in pregnancy, it gets a little bit more confusing with discharge changes and things like that, but you just want to be monitoring for it throughout pregnancy. So, what makes your water break? Sad fact, guys, we don't actually know. There's a lot of things that happen in labor, including how your body decides to go into labor, that we don't know all the specifics around. Most often, we believe that your water breaks due to something about your uterus contracting. It can break if you have an infection, which might make it a little bit more fragile. That is the reason that most people's water breaks is they start to have contractions, but some people's water breaks early with no particular rhyme or reason, and we don't exactly know why. Now, you might be wondering, my baby is moving in there. Can they break the water? And that is a great question. I've definitely wondered that myself, and studies have shown that no, we haven't seen fetal movement be an indicator for a broken bag of water. However, if baby's moving a lot and you're contracting, I would guess that that could be a way that your water ends up breaking. But again, that would be a combination of a couple different things. So let's sum up this video. Number one, most people's water gets broken in the hospital. Well, I do think it's a valid thing to have some towels in your car or at work, just in case your water breaks, because I don't want my car coming back from that if I could just bring a towel and prevent it. Number two, we don't exactly know why your water breaks, but usually it's due to contraction. So if your water breaks, You need to go ahead and call your provider. It isn't always a reason that you need to go directly into labor and delivery, but I think it's important that they know and you guys can talk through some of the things, including like your GBS status, any other issues you're having during your pregnancy, so you can decide if you should head into the hospital or if you could hang out at home for a little bit. The number one thing we are watching for after your water breaks is for any sign of infection, which usually means a fever. But if you're starting to feel achy or anything like that, that's definitely a reason to call your provider or to head into labor and delivery. As a reminder, labor and delivery is open 365 days a year, 366 on leap year, 24/7, just like the internet. Now, not knowing if your water has broken or not is a mistake that people can make, but I have a few other mistakes that people make in their third trimester that you're definitely going to want to check out.